Good afternoon and welcome to this month's show. I'm Luke McCormick. During today's show, we will discuss critical issues facing government and industry leaders in using information technology to improve healthcare and healthcare services. With me on today's show are Ryan Argentieri, Deputy Director of the Office of Technology, National Coordinator for Health IT, Dr. Neil Evans, Acting Chief Information Officer for U.S. Department of Veterans Affairs and Chief Officer for VA's Office of Connected Care, Bill Tinson, Director, Federal Electronic Health Record Modernization Program, Holly Jors, Program Executive Officer, Defense Healthcare Management Systems, Mobeen Vade, Advisory Solution Consultant, ServiceNow Federal Healthcare, Nick Saki, Principal Technology Strategist at Pure Storage, and Ben Cushing, Federal Health and Science Lead at Red Hat. What a big topic, what a timely topic, and what a fantastic panel. Ryan, we're going to start with you. Give us a state of the state, the top line. Perhaps you want to tell our audience, what does the National Coordinator for Health IT do? And then what's up over there?
Sure, thanks Luke for having us. Well, at ONC, we work on the standardization of healthcare data and the management of electronic health information with EHRs, and also coordination of standards-based approaches to that EHI across the federal government and then with industry partners. So we've been very busy, as you can imagine, the past few years, and especially since last March. And what we've been doing and what we're seeing great progress with is increased and enhanced standardization of healthcare data that ultimately helps improve the quality of care. We have launched and standardized the USCDI, which is the United States Core Data for Interoperability, a standardized set of health data classes and constituent data elements that help support and enable nationwide interoperable health information exchange. You'll see this at ONC on an ongoing basis. This is a transparent, consensus-based process by which our federal partners, and again, others from nonprofit associations, industry, and the like, provider organizations, submit their maturity levels for new data classes and elements, but this USCDI really establishes the floor through which we can kind of come together to exchange information. It's a public process, and it lays, we're seeing that it's really laying the foundation to tackle some of the problems that we're seeing that are more pervasive throughout our system. And I know some of our other panelists will speak to some of those challenges, so I'll stop there. But the other item that ONC has been very busy with is helping to really play more a stronger presence as coordinator and bringing together partners, the federal space, state and local governments, territories and tribal communities to understand what the real problems have been since the start of the pandemic and help to educate and kind of bridge the lack of understanding that we find is often the case where technology needs to be, where there needs to be kind of a veil that's lifted, and to help bring people to the table to build consensus again and really make sure that information is moving in a way that benefits both the providers who are treating patients, but also the patients themselves.
Such an important topic, and the outreach, we really appreciate the leadership. Such a timely issue in regards to information sharing. We know the quality of care goes up when the information is shared efficiently. Neil, how about over at the Veterans Affairs? A lot of activity going on over there. I always like to ask first, just make sure you tell the audience how big and massive Veterans Affairs is, and then tell us what's happening over there at Veterans Affairs. You got a new role right now. You're in a dual role.
That's right, Luke. It's exciting to be here talking about healthcare IT. As you mentioned, let's talk a little bit about the VA first. The VA, our mission is to fulfill President Lincoln's promise to care for those who have borne the battle, for their widows and their orphans, by serving and honoring the men and women who are America's veterans. And we have a pretty broad mission in VA. More than 350,000 employees coming to work every day to serve veterans, whether it is delivering and supporting benefits delivery, our team and memorial affairs who are running and supporting families at challenging times in their lives as they've lost veterans through our veteran cemeteries. But today we're talking about healthcare IT, where we in the VA take care of more than 6 million patients a year at our healthcare facilities, more than 1,400 facilities across the enterprise, across the United States, all 50 states, territories, et cetera. So a pretty big mission, a very large healthcare system, and one where we're caring for veterans in the community. In our healthcare facilities, where we're coordinating care with our community partners. And interestingly, where over the last, during the pandemic, we've been actually delivering care through part of our fourth mission to support the American healthcare system in the time of this public health crisis, delivering care actually even to non-veterans as part of our fourth mission. So really a pretty broad perspective, and underlying all of that, of course, is a lot of technology, health information technology that powers our ability to get the right data to our healthcare providers at the right time, and to support veterans in having access to the information that they need to understand their own healthcare and to take control of that and as they manage their own health journeys.
It really is amazing, the quality of the care with the technology that's embedded into these devices. And then, of course, the technology is allowing you access to the care, right, remotely, et cetera. I'm sure you'll talk more about that. Bill, how about at the Electronic Health Records program? A lot of activity going on there. You're right smack in the middle of information sharing. Give us the state of the state about how things are going there.
Thanks, Luke. At the firm, we're about the things that we do together, right? It's the Federal Electronic Health Record Modernization office that I'm representing today. And we're between all of the things that Neil talked about and that ONC is doing. ONC sets the stage for all of us on the interoperability and the IT standards, and we participate with them. And they're actually setting up a new work group or committee, I'm not sure which it's called, where they bring all the EHR or potential federal EHR users together so that we get to the right answers. But the firm is set up in that between the DoD and the VA, and we brought the Coast Guard in at this point, on the things that we do together. So the operation of the common federal health record that we've created about the patient, not who delivered the care or where the care was delivered. So that space where we need standards, we need common workflows, we have a single enclave, we need to protect the data in a consistent way, and we need to make sure that we get the right capabilities delivered to the military health system as well as the VA health system, so that the two systems can work together. We can get beyond interoperability, at least where the two systems are concerned, because we're using a single common record about the patient. We're transforming the experience for the patient and the providers from what I think of as akin to how telephones used to work, right? I would call your home, Luke, or your office and ask for you and see if you were there. What has happened as we transitioned to cell phones is I would call you. We're trying to do the same thing with the health record so that it's about the patient, not who delivered the care, where it's delivered. So we don't call the facility and say, hey, what do you know about Bill? We just look up Bill's record, and through the standards that ONC helps get in place and the common record that we're using between DoD, VA, and the Coast Guard, that full record is available to the providers and the patient when they need access to that information.
Which is fantastic. And, the leadership that's happening in developing this capability, no doubt will go well beyond the ecosystem that you're working with now at VA and DoD and certainly the Coast Guard. Holly, how about at healthcare management systems? Once again, why don't you tell us what that is and how you all fit into the superstructure here, and then give us an update as to what's happening.
Well, the Program Executive Office for Defense Healthcare Management Systems is responsible for delivering the DoD implementation of the electronic health record. So we partner with Bill Tinston, with Dr. Evans, with with ONC as well in terms of standards. But we are looking at implementing a new modern electronic health record across the entire military health system. We are actually about 30% complete with the entire military health system at this point. We've got more than 50,000 users operating at more than 16 states. We're working our way from West Coast to East Coast, and actually we have our first deployment at an Oconus site in Hawaii coming up as well. So really excited to start working through as we expand beyond CONUS for delivery of the electronic health record. So that's really the foundational work we're doing. We started with that EHR and bringing standardized workflows and really shifting the mentality from a documentation system to a true workflow system that enables the providers to really document as they go and as they're providing care. And so that all feeds into this single common record of where we can start to connect information about that patient. So that is the foundational work we're starting with. In the other areas within our portfolio, we have the operational medicine, which really is an extension of the healthcare delivery, but also incorporates all that medical situational awareness that you need in terms of the point of care in theater environment and patient movement, and bringing that patient safely back into the healthcare system with all of their records, all of their information. So it's about providing that the healthcare when it's needed, at the point it's needed, and then bring that in. So that's the operational medicine piece. And then we also have a portfolio for business intelligence and data solutions. And that really is more foundational work today, where we're working on the platforms for our digital transformation, but it's that connective tissue. You'll hear me talk a lot today about getting that data where it needs to be for people to make the right decision they need. So whether that's in running the hospital, whether that's information right at the point of care to improve outcomes or improve patient safety, or decisions that are needed in terms of readiness for our military health system. So working all those pieces together. So kind of the nexus of a lot of the things that I've talked about today in terms of getting that out to our DoD users and serving our 9.5 million beneficiaries.
Wow, fantastic outline of the ecosystem and getting the data where you need it and all the data, making sure it's there when you need it. Mobeen, in order to get all these things together, you got to have these systems and solutions. And I know that ServiceNow has been providing some of these types of capabilities. Tell us what's happening at ServiceNow and how you fit into this federal healthcare ecosystem.
Yeah, thanks, Luke, and thanks for having me. I'll probably echo a little bit of what the previous panelists have already mentioned. We've had a big focus alongside our federal partners of making life easier for patients, providers, and federal employees. So information technology is obviously at the core of those transitions, how you connect people, functions, and systems. We've seen a couple of things become points of priority as part of all of this, right, especially in the pandemic. So things like digitizing manual systems that have just been hanging around for too long, and then taking existing manual systems and starting to move towards more efficient digital services. So when we talk about digital workflow automation, where are our opportunities for streamlining technology services? Been a big point of focus. In addition to that, when we talk about streamlining, we're also talking about innovation. Right, innovation traditionally has been something that, it was looked at as sort of a long-term engagement. But what we've been seeing is that CIOs and CTOs want to become more innovative and quicker in projects that won't take 12 to 18 months. So figuring out ways in which we can deliver efficient services and get quick wins. And the last thing I'll mention really quickly here that we've seen a lot of is just cloud forward, right? So getting off of on-premise data center work, trying to figure out how we can leverage the efficiencies of the cloud more effectively. And so we've been a big part of working with our federal customers and federal healthcare customers to help them with all of that. So
no doubt those bench-ready platforms really important as you're trying to deliver these solutions quickly. Nick, I think about all the information that's being collected and making sure that it's being done securely, efficiently, readily available, immediately able to be retrieved, et cetera. Tell us what's happening at Pure Storage. I'm sure that you all are just really going guns a-blazing here in regards to enabling these capabilities.
You're absolutely right. So sort of as the wholesale data custodians in an architecture, the data service platforms and Pure Storage particularly have focused tremendously on how do we protect the data. Throughout the pandemic, patient records, hospital systems have become tremendously popular targets for ransomware, as an example. The questions that we present ourselves is, since we have tremendous quantities of patient information and of course disease and epidemiology information, how do we facilitate technologies within our systems to protect patient data? So we've integrated a tremendous amount of technologies that help us create immutable and impermeable data components, the patient records themselves, to ensure that they are relatively immune to tampering or to crypto locking. And the other thing that we've done is focus a tremendous amount of energy on how do we restore data as quickly as possible. And I'm not talking about a couple of hundred, even a couple of million files, like terabytes per minute. So in the event that we have to bring data back out of escrow or restore it quickly, we can do so in a user meaningful period of time. So if we can bring back, several hundred terabytes worth of data within, an hour, that's tremendously beneficial. I should say several hundred terabytes would take a couple of hours, but that's still tremendously beneficial for an organization to get themselves back in operation as quickly as possible. I think the second thing that we've done, if I can touch on it very quickly, is we partnered with the National Institute of Health and the Centers for Disease Control last year, particularly at the outbreak of the pandemic. And then of course, as our understanding of the disease evolved, being able to process that data, collect that data, make that data available as quickly as possible, as widely as possible to the life sciences community, was essential in helping us wrap our arms around what was SARS-CoV-2 and how did it behave. So the ability to continually allow researchers and policymakers to understand the disease itself and its spread and evolution was something that we were very proud to be able to partner with and be a part of. So those are probably our two biggest components: is data protection, and then the data analytics and research, data availability, and data mobility that support the sort of widespread whole of government efforts to support the health of our citizens.
Very big and very important to the ecosystem here. Thank you for that, Nick. Ben, how about at Red Hat? Red Hat, we think of Red Hat as the building blocks of a lot of these systems and environments. How do they fit into the healthcare ecosystem? And give us a state of the state there.
Yeah, I guess you can say Red Hat's probably the most ubiquitous software company in the world, just by the nature of how many organizations use open source and the specific open source projects that we foster. Outside of that, I'd say the thing that we're really excited about and getting involved in the most is around the implementation of process automation and the overlap with AI. So Ryan mentioned the new rollout of data interoperability standards from the ONC, and as an implementer of FHIR standards, I've been able to see the immediate impact on the quality of data accessibility. But leaning forward into semantic interoperability, the Mayo Clinic is using process automation technology to drive agile real-time delivery of standards-based clinical care pathways. And they're working with standards from the BPM Plus Health organization under the Object Management Group, which was responsible for widespread automation across manufacturing, finance, supply chain. And Mayo is they're a member of the BPM Plus organization, which is inclusive of Department of Veterans Affairs, American College of Obstetrics and Gynecology, American College of Surgeons, American College of Emergency Physicians, et cetera, et cetera. And the work that they're doing over there is actually raising the quality of clinical operations dramatically and allowing for new knowledge from, let's say, NIH and ONC to make its way into care much faster. So we're just in general raising the tides and raising all the boats with it. That work is incredibly impactful and something that Red Hat's excited to be a part of. And then once you've automated these kind of activities, that's where you actually start to see AI in the form of clinical decision support actually get involved in clinical operations. And there's some really cool examples of that I hope to get into today.
Perhaps you'll give us one a little bit later on in the show. We're going to take a short break and we'll be right back. You're listening to the Federal Executive Forum on Federal News Network.